I'm sitting in my clinic and doing this video for you. A very, very important and interesting topic. Whether there is a chance of contracting a disease by the patient from a doctor or vice versa. Now, if you want to know about these interesting topics, you want to become aware of many medical things, then you may subscribe this channel Rahul Sen archive. Now I'm coming back to the topic. Whether there is any chance of a patient getting a disease, contracting a disease from the doctor. Now I remember a television serial where this anesthetist, young anesthetist, was HIV positive, and still he was working in the hospital. Whenever he was imparting or giving anesthesia to a patient, he used to volunteer that, see, I'm HIV positive, but I'm taking all the precautions. So do you want me to go ahead with your anesthetic procedure, or do you want somebody else? Now, most of the patients went along with him. Theoretically and also practically, the chance of contracting HIV from this doctor while he was doing the anesthetic procedure is almost nil. Now, from a doctor, contracting a disease is very, very rare. It's maybe almost unheard of, because as a patient, you're not coming in contact with a doctor's blood or large amount of secretions which may be infected of the doctor's body. The doctor is covered with all sorts of gears, and he's not going to bleed or just excrete or do something which those infected fluid of his or her comes in contact with your body, especially deep inside. Now, but on the other hand, the doctors are coming across blood, large amount of infected excretions and secretions of many infected patients daily. They have a huge chance of contracting the disease from the patient itself. If I tell you that, you would be knowing that, you may not be knowing that thousands and hundreds of doctors have died of contracting hepatitis B from the patient, even HIV, contracting HIV from accidental needle pricks from the HIV infected patients, and recently hundreds and thousands of doctors died from COVID virus, contracting it from the patient. So as the doctor is coming in contact with these infected blood and infected secretions of liters every day of other individuals, the patients, they have much more risk than contracting the patient's disease. On the other hand, because the patient is not coming in contact with the doctor's blood or doctor's serum excretions like that, there is negligible chance of the patient contracting anything from the doctor. So you're safe there. If you like this video, please like it, and as I said, I would be delighted if you subscribe my channel.